Hello everyone, my name is Salim. I am currently a graduate student at Eastern Kentucky, attending in the Psychiatric Mental Health Nurse Practitioner program. This is a presentation and a project proposal to implement music therapy along with other treatments to positively enhance recovery process for patients diagnosed with substance use disorder. According to the Substance Abuse and Mental Health Service Administration, substance use disorder occurs when there is recurrent use of alcohol or drug which causes clinically significant impairment, including health problems, disabilities, and failure to meet major responsibilities at work, school, or at home. The 2019 National Survey on Drug Use and Health reports that approximately 19.3 million people aged 18 and over had a substance use disorder in the past year. And in 2017, more than 70,000 Americans had died from using illicit and prescription drug and overdosed. Substance use disorder still continues to be a major health issue, which is affecting many in various ways. It is vital for nurse practitioners to compose and implement an effective treatment plan that will allow patients to be motivated to complete their recovery process and abstain from using drug. Music has been shown to have a positive effect in altering and improving mood in therapy sessions. Music is regarded universal. Its significance can reach virtually everyone. It is also cost-effective and can be implemented to different demographic populations. Incorporating music therapy along with other treatments is likely to have a positive effect on patients with substance use disorder by improving their mood, participation, and could possibly provide encouragement to continue their recovery treatment for better health outcomes. The supporting theoretical incorporated with this project is the theory of music, mood, and movement to improve health outcome, which was developed by Maroc and Higgins. This theory was synthesized by combining the psychological and physiological responses of music to increase physical activity and improve health outcomes. The PICO question for this project is as follows. In patients with substance use disorder, how does incorporating music therapy along with medication compared to medication alone improve the length of patient's recovery within 1 year? In order to answer this question, for this project, 3 studies that included systemic review, randomized control, and qualitative study were reviewed. These studies concede the overall importance of augmenting music therapy into patients' treatment plan for an effective recovery. These literatures illustrated a valuable evidence supporting that the use of music therapy through different measured variables and settings in mental health hospital resulting in a positive outcome. The project plan to implement music therapy is as follows. After obtaining project plan approval from IRB, the interprofessional team will conduct comprehensive staff meeting with appropriate unit, which in this case, it's going to be chemical dependency. Nurses, activity therapists, and social workers and music therapists to introduce and educate the project. Appropriate staff personnel and administration will be consulted in developing an electronic or paper data documentation for this project. In addition, the project team will prepare and circulate information flyers as well as wall posters highlighting key points of the intervention plan, location, date, time, and contact information. Interprofessional will be conducting a monthly meeting to discuss the project's progress. In order to identify patients or diagnose, different screening tools can be used. Some which include a brief screener for alcohol, tobacco, and other drugs, and tobacco, alcohol, prescription medication, and other substance, which is also commonly known as TAPS 1 and 2. These tools are available on National Institute on Drug Abuse to be used by clinicians. Another screening tool can be the DSM-5, which has a different signs and symptoms, which shows the typical diagnosis for substance use disorder. Once patients are diagnosed, treatment plans are established depending on the patient's preference. As part of the treatment plan, music therapy will be incorporated with other treatments, that include cognitive and pharmacological therapies. This project will be conducted in a chemical dependency adult unit over the age of 18, and patients will receive either an individual or group music therapy sessions. The therapy sessions will be 1 to 2 times a week for an average of 30 to 90 minutes. During session, music therapists as well as nurses will evaluate patients' reaction, participation, and the perception of the therapy. Post-session, patients will answer evaluation questionnaires concerning their therapy. Objective and subjective data will be entered in patient's medical record designated for the project. To evaluate the outcome of the intervention, physicians, music therapists will reevaluate patients' risk for substance abuse using the same initial screening tools used to identify the patients. Both initial and post-intervention data will be compared to assess the patient's progress before and after the start of the intervention. Patients will be assessed on their recovery, relapse, readmission, motivation for treatment, as well as craving for the use of drugs. Evaluation will be conducted post-intervention, initial post-intervention, and also it will be 3 and 6 month follow-up to see if the patients are still following their recovery process, or if they have a relapse or have gotten readmitted to the hospital again. A brief timeline chart is provided in the poster for further review. In conclusion, this project proposal will allow healthcare workers to understand and examine the effectiveness of music therapy on patients diagnosed with substance use disorder. Furthermore, adaptation of this project by hospitals and clinics will benefit many patients in achieving an optimal recovery process and will equip healthcare providers with an additional treatment care plan option. Thank you for listening to the presentation.